Back injuries are a growing concern for Manitobans, especially when those back injuries occur at work.
Some positive news is that the number of back injuries over the last 4 or 5 years has been decreasing. However, it still is the most common type of injury we have, and of the 15,000 time loss injuries we have per year, about 1 in 4 is a back injury, or 25%.
Typically in a workplace, the mechanical injuries are sprain and strain type injuries where you may be lifting or doing a repetitive motion or any sustained load that overstresses the tissues in the back.
The good news is that most back injuries heal within 1 to 6 weeks. But what might surprise some people is that rest isn't necessarily the best medicine.
Well, the old school thinking about treating low back pain was essentially a bed rest. Well, physicians would tell patients you have to have bed rest, and to the point where people would become very stiff, very sore, and they try to get back into activity, but would find that because they were inactive for so long, now activities that didn't used to bother them more. The new school of thinking, and it's been supported by research, shows that a more active-based approach that keeps people limber, keeps people moving, they tend to do better.
When you are injured, the best thing that you can do is walk. It's a very gentle, non-impacting force and gets the whole body involved. But other activities like swimming or riding your stationary bike or dancing, whether it's ballroom dancing or even going out to a club, you can move your body as long as you respect it and don't go into your pain. The key point is moderation. It's being gentle, it's listening to yourself and not worsening your problem, but keeping in mind that you should and you can be moving for the best result.
An earlier return to work can also be good for a person recovering from a back injury.
Our goal at WCB is to help people get back to health and work as soon as possible. And the best way to do that is to work with your practitioner, your healthcare practitioner, and follow a treatment plan, and also participate in a return to work program. So the value of return to work programs is that it has been shown that people that do participate in them get better quicker and are able to return to the job they were doing before they were injured. And there's a real benefit for the workplaces to retain trained and experienced people and keep them in the workforce. And so it certainly is a win-win situation when you do have an effective return to work program.
Well, research has shown that if we get people back into some form of gradual return to work, either that with restrictions or just generally getting back to a gradual return, 2 hours a day to 4 hours a day to 6 hours a day to 8 hours a day, they're the people who tend to recover quicker.
Typical modifications normally include lessening the loads that you're lifting, modified hours, alternating jobs so you're not continually doing one job so there's not that continuous stress, and changing positions, sitting, standing. There's all sorts of modifications that will help a worker return while still experiencing some pain.
For injured workers, an earlier return to work aids recovery, reduces the amount of income lost, and keeps them feeling connected to their workplace. Employers pay less WCB costs, maintain their productivity, and save time and money that would otherwise be spent on hiring and training a new worker. But the goal is to prevent injuries from happening in the first place.
On a day-to-day basis, to prevent back injuries or to maintain your back health, the best thing that you can do are daily stretches for your back, knee to hugs, arching backwards, side bending, doing everything that we have the ability to do. Like, our back can bend and it can twist, so it should be kept there in a safe way, but also make sure it's strong, not just loose. So some partial sit-ups, some bridging, some squats. Again, squats are really important to have those legs strong for lifting from your legs rather than from your back. Everything that ails our body, I think, has to do with lack of activity and respect, back to respect for your body and consciousness of your body and how you are moving in your daily life. So strengthening your body, especially your core and your legs, and which goes hand in hand with knowing how to lift and how to move properly rather than these slouched and these bending and twisting ways that we are accustomed to simply by habit.
A more active approach keeps the weight off. A more active approach keeps you limber. A more active approach keeps you strong. The muscles around the lumbar spine are like any other muscle. If you don't use it, you lose it. And that's typical of these, of any muscle, more specifically for the back.
When it comes to your back, whether you're on the road to recovery or taking the path of prevention, it's worth your while to keep exercising, stay active, and get back to basics. And don't forget, you can get your free Back to Basics booklet at www.safemanitoba.com.